Track them back if one has.
No, the implant is not for retracting the teeth. The implant is for rehabilitating the lost teeth.
Okay.
The everything else will be done surgically.
So
The
we
way
can
she,
retract
yes,
it
of course,
surgically?
yes.
What is the percentage of retraction that we could
Surgically,
surgically?
I can take 2 centimeters also.
Just 50%, 60%.
No, we can make her very beautiful. Not 50% and all, 99% maybe. Why 50%? No, very high percent we can get her. It's not 50%.
Someone was saying that since you mentioned that the alignment of a face is vertical growth of a jawline.
Yes, absolutely.
Because of that, there is a very limited room for surgically.
No,
someone mentioned
yeah.
it before.
See, these are not very straightforward surgeries that a lot of surgeons do. First of all, but having said that, um, we do a lot of surgeries even more complicated than this. Hers is pretty much straightforward. It's a little challenging because the arch is high arch and all of that, but we can get around that. We have to see how it works is now I'm just simply telling you based on my experience and how she looks. But really the planning for the osteotomies and everything starts with the scan. So you're saying she has a high arched palate and her thing is down. So we can plan osteotomies around that and correct it.
The scan.
Yeah, this is there on the same. I've seen that. So we can do it.
So you were saying you've already checked.
Yeah. We can give you the result if you want. Like how we can make her look very, very beautiful.
Her jawline will
everything.
Set back.
Everything. So see, the main thing is her mouth is open, chin is retracted, vertical height is there, lip incompetency, kami smile. Every aspect of the imbalance will be taken care.
And this all will be done in one sitting?
Yes, all can be done in one sitting.
And then the implants after a month?
That also, if you want, I can do the same sitting. Suppose you're willing to get the dental implants in the areas where the tooth are missing, that also can be done in the same go. So she will not undergo any pain after that.
Once for all, everything.
Once for all, yes, we can do that. Even that we have to plan. So that we have to plan, that I have not yet planned. So because we're just seeing the bony thing. That my team will check the length of implant that we could use, what type of implants, and we'll suggest to you.
Okay. And what is the recovery time? And how long is the surgery? And what is the post-recovery?
So see, the recovery, you live in Bangalore, but still I would want her to stay with us for at least 3 days or 4 days. After that, she'll have to come back for the first follow-up after a week and then another follow-up after a month, which means 1 month to 1 month and a week will be the total recovery period for her. First few days, liquid diet will be there. Next few days, soft solid diet will be there. After that, after 10 days, she can get back to rice type, but not chapatis, like not heavy chewing things. That can happen after a month. That's with the recovery.
Looking at her weight and her
doesn't matter
right now and everything.
So what will happen is, we will get her medically totally evaluated. So the surgery is going to be under general anesthesia. So there are various requirements for a patient to get under general anesthesia, including ECG, blah blah blah, blood test, fitness, physician, anesthesia. That will happen, and if there is some issues with that, then we might even cancel surgery ahead of time and let you know. But I saw your case sheet and my doctors haven't mentioned anything like that. So
I mean, if you look at her, she met with
I know.
car accident before, and she has a
Humerus
rod in
fracture.
one of her arms.
2015 she's had.
Yes.
And she's not on any medication right now.
Not at all. I mean, in that way, she's quite healthy.
Then it shouldn't be a risk at all. But we still work her up.
Of course.
So what happens is once we'll write the rough plan today so that my team can let you know the approximate costing. I've already told you the recovery. Remember, this is not an emergency surgery.
Right.
This you can do next week, next month, next year. It's like an elective procedure. But whenever you decide to do, that's the time we'll start planning. How the planning works is slightly different. That scan that you've taken is for diagnosis. It's for finding out the length of the bone, where all the issues are, not to plan the surgical correction. That's a diagnostic scan. After this, once you say, okay, we're going to take a couple of more scans, that goes to a separate software. This is another German software for planning, for diagnostic. That is for planning. In that, we will be able to plan, okay, how much of the upper jaw going up, how much it goes back, are we doing any rotation, what is the movement of the lower jaw, how much of rotation will happen, what is the reduction in the vertical height, how much of angle will create, what will be the chin line, everything. That needs a back end work of 3-4 hours. And my time, at least of half an hour, my team will work on everything. Then we sit and we say, okay, this is good. Once that happens, we print that. We have a 3D lab, we print it. Once the printing is done, then we can plan the surgery.
How long does the surgery usually take?
A surgery like this might take 3 hours. Ballpark, huh? Half an hour, give or take.
Okay. And is there any correlation between the way she's feeling right now with a bit lethargic, or she might sleep a little longer, or she might have some digestion issue or health issue? Is it a direct correlation with the way her sleep is?
So I think it's probably got to do more with her autism and not so much with the way
Not with the
her,
feeling paper.
I don't think so. But you know what happens? When someone looks more presentable, when someone looks more balanced on the face, then we also change our opinion. People, it's just like that. She also will feel better. I have had patients who will put lipsticks and she knows what I'm asking her. So now their self-esteem will be low. Once they see the change that's happened to them, you can see some of them come up with a new leaf. I don't guarantee you that. I've seen happening in a lot of my patients. So if time is not a constraint and if money is not a constraint, she's a very, very good candidate that you should go and do it. If you have any of these as a constraint, then you can wait and plan.
Finance is one of the constraints wherein we would like to, if we can get an estimate.
They will give you an
pre-surgery,
exact. No,
we'd
yeah,
like to approach
absolutely. We will give you an estimate today itself. I'll write the rough plan. And see, the way it works is we don't charge every patient precisely as to what happens. Because what happens, we have to give package. So if it's like this plus this plus this, irrespective of the movements and the rotations we do, the costing stays put.
Right.
Otherwise, what will happen is sometimes when the surgery becomes 4 hours instead of 3, then you'll expect an escalation of 15-20%. That will not happen. So to prevent that, we have come up with a mean costing, which my team will let you know. And it's going to be fixed.
Perfect.
The reason is because prior to the surgery, we'd like to take this and then approach our insurance company
Okay.
so that they can, because this is more of a, it is not less of a cosmetic and more of a physiological problem that we have.
More of a growth issue, but
Because
unfortunately, a lot of the insurance people will not consider.
maybe if you give a good diagnosis, or
We will give you, but
probably
still,
approach them.
I will do everything from our end. My team will do the same. But in spite of all of that, the insurance companies are like